So we're going to be discussing gout today, and we'll be discussing gout, um, a kind of arthritis. We'll talk about the causes, the symptoms, and of course, some management patterns and the recent advancement and recent discussions and methods of treating gout as entrenched by one member and by a member of the community or the group. I would like to play is a recording of his of a message he sent in. But before I do that, I'll be doing that at the end of the discussion or seminar, as it were. I know we've all heard about gouty arthritis, and stuff like that before. But I also know that very many persons might not have completely heard about it. So today I will take it not in any particular order, but try to make us to understand it. So today, as we all know, my name is Adebanjo Ademola Oyemi, and strictly, I know we would have all seen or experienced some of this picture that I'll be sharing now. This man here has pain around the neck, the shoulder, the left shoulder, another one here on the right shoulder. And then, of course, you can see this deformity in the hand of a certain person, some urate deposit in the I think the right middle finger, and of course some urate deposit and even also amputation. And we can also see that this person is holding on to a left wrist as a sign of gout. So what exactly is gout? Gout is a form of inflammatory arthritis that is characterized by sudden and severe pain. Of course, there'll be pain, there'll be redness, and there'll be tenderness. So sometimes it can also be warm. It's caused by high level of uric acid. Uric acid deposition can be in the joint, can be in the kidneys, can be even in the heart. And so when it's deposited in the joints, then it causes what we call gout. And that leads to the formation of urate crystal in the gout in the joint, and then of course that will lead to pain, tenderness, redness, and the likes. So what are things that would cause gout, as we want to discuss today? Our diet is very important when we're talking about gout. That's consumption of foods high in purines. And such food we'll look at now, food like red meat, particularly organ meat, certain seafoods like shrimps, lobsters, and the likes can contribute to increase or elevated uric acid levels in the blood. And of course, alcohol has also been mentioned as a cause of gout, sometimes directly, sometimes indirectly. And another thing that's been found to cause gout is that it runs in families, and that is that there's familiar predisposition to gouty arthritis. And so, which means if the father has, there is likelihood that some of the children might get the gene, that will make them to have deposits of urate or uric acid in the joint, causing pain from time to time. Another thing we can say would be a cause for gout would be certain medical conditions like diabetes, hypertension, kidney disease. They've all been found to increase, our risk of having gout. And of course, some medication like diuretic that we also use for treatment of hypertension is also implicated in gout. And of course, aspirin has also been found to be implicated in gout. Yeah. So, what are the symptoms we expect? Like I said before, this whole seminar will be kind of short. Just want to, lay a foundation on what gout is and why it is quite important. The symptoms are quite simple, and we've mentioned them before. For the first of them will be sudden pain. So the pain does not come insidiously, like slowly. It will just come once and then begin to cause such a person some discomfort. So we have sudden pain, which is the hallmark of gout. It's quite sudden, it's intense, and then it occurs more at night, and it affects the joint at the base of the foot, and of course anywhere else. It could affect the joints of the ankles, of the knee, of the elbow, the wrist, and of course the fingers. And of course you can also quickly see that the place will now become reddish and will become swollen. So the affected joint will become red, become swollen, and will become quite painful when you touch. And with all of that, you expect some level of reduced mobility. So you will not be able to move such a joint quite well. So walking may be difficult. Holding things, if it's in the hand, may also be difficult. You can see this man now. He has gouts, and that's why you can see that the place is kind of painted just to demonstrate what you expect to see. So such joints of the finger, these little joints, could have gout there. So how do you diagnose gout? It's quite simple. Your doctor will draw blood, and sometimes your urine can be a pointer, because you could have uric acid crystals in your urine. But essentially, blood is taken from, whoever is presenting with such pains. We take uh, blood for uric acid test, and when it's increased, I think is when it's more than 6 milligram per dl or thereabout, then we say there is hyperuricemia, and with hyperuricemia there is an opportunity of this uric acid being deposited in the joints, and then which would eventually cause gout. And but more dangerously, it's not only the joint that it gets deposited into; it could get deposited into the kidneys and cause some kidney disease. And of course, it's possible for your doctors to also aspirate fluid from certain joints that are affected, which are now checked under the microscope to check for the presence of urate crystals, like has been mentioned. So it is possible to do that, and with that, one would have been diagnosed of gout if it's present. Another thing is how to manage and of course treat gout. Gout is a kind of arthritis, is a painful thing that happens to people. So when there is pain, there is always painkillers. So non-steroidal anti-inflammatory drugs, which are otherwise called NSAIDs, you have the likes of diclofenac, ibuprofen, feldene, colchicine, and so many other ones. Colchicine on its own is for pain. Is for pain, particularly that of gouty arthritis. And of course, you could also be given, your doctor could prescribe corticosteroids, which is like prednisolone, dexamethasone, hydrocortisone, just to mention a few, to try to relieve the symptoms of gout. However, there is another drug which is allopurinol, xanthine oxidase inhibitor, which is used to particularly reduce the uric acid in the body. So when uric acid is reduced, then we expect that there will be not much deposition of uric acid and of course formation of urate in the joints. And so allopurinol is also a drug that is used. We have another drug called febuxostat, which is also used to lower the uric acid in the body. And of course, another thing to do in preventing gout is lifestyle changes, dietary modification, such as reducing intake of purine rich food. I've mentioned them before. Talked about red meat, organ meat, reduced consumption of alcohol, maintenance of healthy weights, and staying hydrated. You'll hear that from the testimony of one of us, when he talks about it quite soon. And of course, the preventive measures are very important. So you need to avoid the triggers. We mentioned the triggers. The triggers are like, the red meat, organ meat, and the likes. the medication that could cause it, like diuretic, as we mentioned before. Excessive alcohol consumption should also be stopped. And of course, trying to drink as much water as possible, at least 3 liters on a daily basis, is key. So some individuals, of course, might also benefit from the use of the allopurinol that we have mentioned before, and the other drugs, just to prevent the attacks of gout. Now, so what are the complications we expect when gout is present? Untreated or poorly treated gout, as we said before, would lead to deposition of urate under the skin and, of course, in the joints. And the urate crystals can actually lead to this that you'll be seeing next, which is like a deformity caused by the urate crystal. So the person looks quite unsightly at that point. So, as we conclude today, I would like to, tell us that even though gout is painful and potentially debilitating, it can actually be taken care of by, adhering to some of the things we have mentioned before. Why does not truly have a cure, but effective management strategies would help in managing the symptoms. However, today, one of us has had gout for about 14 years, 2010 to be precise. He lives in Australia, and then just about 7 months, just some like last year, he encountered, one of the things he did, which helped him to actually be to be gout free, to be pain free, from gout, as his testimony has been. I would like to play for us. Before I say thank you, I would like to play for us what he particularly, said himself concerning this condition called gout. So please join me as we listen
How are
forward.
you, Demola? Thank you very much for giving me this opportunity to quickly share my experience about gout. I've had gout for, I think, upward of like 14 or 15 years, thereabout. And I've had series every summer, warm weather here in Australia since 2010, thereabout. Has been excruciating. For those that have gout, I'm sure they can relate to the sort of pain that it is. But not until last year, I'll say October, I've been managing it largely with my diet, and I'll have the bouts maybe a couple of times a year. But it's not just the frequency, it is the length that it takes before it goes away. I remembered when it started, but under a week, it would have gone away, but I think it deteriorated over time. I've had multiple series of tests, kidney tests and all sorts of tests, and my kidneys are fine because apparently when I've gone to see different GPs, they've always guessed that maybe it was a deterioration of the kidney. But in my own case, it wasn't. It's largely caused from really poor diet, really poor hydration. So often that's why it often happens to me during summer. So I think I never had it in Nigeria, so I didn't know what it was until I traveled here. But I think one thing I would say that has really helped me, I would argue, is my refusal to take any of these, what I would generally call orthodox prescribed medications. And I was prescribed colchicine, which I think many gout sufferers will be aware of. And I went back to read a lot about the contraindications, and I didn't feel it was nice until anyway. Last year, I stumbled upon this about medication, and it's just done marvelous, marvelous for me. I have I haven't eaten until last year any form of red meat, goat meat, beef, whatever, name it. And even when I ate chicken or other sort of white meat, I was extremely cautious about it. So, but now I am free. I'm still very uh, mindful of what I consume. I drink an average of like 2 to 3 liters minimum at intervals per day. I try to hydrate at night as well. Yeah, so it's yeah. I feel a lot better now, and this is probably the last summer was the first time in 12, 13 years that I have not suffered from, excruciating pain. So anyway, I'll leave it there so I don't spend all the time. We can pick up this conversation much later. All right. Thank you so much. We'll talk later. Bye bye.
All right, thank you, Dr. Boyega. Yes, thank you so much. For us doctors, we would not particularly encourage persons not to adhere to prescriptions and use the drugs as are being prescribed. The reason we give these drugs is because we want better quality of life, to patients. That's why we give colchicine. That's why we would give allopurinol. That's why we give penicillin, even though they might have their different side effects. But the whole aim is as good as yours, which is to ensure that as much as possible we are able to deal with the symptoms and then improve the quality of life of persons that would have any issue at all. So as touching gout, therefore, we would always prescribe this medication. But what then when he mentioned that, oh, in the last 7 months, I know I saw him about 5 years ago, or thereabout of 4 or 5 years ago, when he came over to the country, and he wouldn't eat meat and all of that. So I said, oh, what was happening? And of course, he mentioned the issue about gout. Now, he mentioned also just recently how he has been able to go back to some of those don'ts, the don't food in his case, and able to eat them, again. And that was when, we got talking, and he said if he started up on some, fruits that were just merged together into something that is used. And for the past 7 months, at least from his testimony, he has not had the kind of pain that he used to have, even when he was not consuming, those taboos or those food that he was asked not to take. And that was the fascinating part of this, and that I felt okay. It was important to talk to us about what gout is. Maybe you have been having these pains, in your toe, inside your toes, probably your shoulder, different joint areas that will just come up after eating certain food. You don't know what has been causing it. It's been debilitating, it's been disturbing. Even, or probably you already have, some urate deposit in the joint causing deformities, or you have just been going through excruciating pains. I would like to recommend that you visit your rheumatologist, to get your a confirmation of your diagnosis. Very, very key. You can do that because in doing that, it helps you to know exactly, what is wrong. So if you're going to pray about it, you're going to, use the medication given to you by doctors, or you are going to strictly just have faith that it goes away. You need to get a diagnosis at least so you know what you're praying about. So at this point, I felt, well, if he was going to talk to people about some of the things he has done there, why not? Yes. So I would like to say that whoever is planning to get treated or get some diagnosis, or you already have a diagnosis, But you just want to know exactly what he also did in his own case in Australia. You can probably just private chat me, and then we can put you in a kind of community, or you have persons that are also having issues with these joint issues, joint pains, and it's been said to be gout. Remember the diagnosis. It is swollen, it comes up suddenly, it's reddish, and it's very painful to touch. You can please private chat me, and then I can put all of you in a community, for further discussions on how to ameliorate, this very terrible disease. Like I said before, our aim is to ensure that we all live healthy. The aim of everything we do, indeed, on respiration and on every other channel, and of course, what we do as doctors is to ensure that all of us live healthy and live better. It's on that note that I would like to say thank you for those that have joined us. I know many persons are still going to go through the YouTube channel or whatever other channel they can get this served and probably watch this. I want to recommend that we all watch it, um, the, and pray that God would help all of us, to be better in what we do. Is on that note that I would like to say thank you, um, and probably try to end this webinar, seminar, whatever it is today. Is the first of the different things that will be coming up this way. Be on the lookout, for it. By the grace of God, we'll do more to ensure that we are all healthy, and we are well. I don't know if anyone has any question. If you have any question, I can see a few persons are online. You can just probably just ask your questions. I'll be glad to answer them. If you can't ask your questions now, you can at least, drop them in the group chats, and then we would, of course, be sure to answer them as at the appropriate time. Thank you very much for listening. Thank you for those who have joined. We know many more will still, watch the repeat. It's going to be on the Westpiration channel. We're going to be leaving it there for you to watch and then get back to us as the case may be. And we might still do this again, maybe publicize it and then do it again, just for all of us to listen and watch once again. Like to say thank you. In If nobody is asking any questions, or you still have questions to ask, please try and leave them in the chat section. Would gladly answer your questions. Um, yeah. So I'll just wait a few moments to see if anyone will ask any questions, and then we can just then call it a wrap. Yeah, sorry again. We started quite late because we had quite some technical issues. The screen, I was trying to share my screen, and the software I was trying to use was malfunctioning. But we are glad we at least had it today. We're going to be pinning it. We'll pin the link to the Wellspiration group, and expect all of us to go back to the Wellspiration channel on YouTube to watch and comment. And for whoever is interested in learning more about gout, or you have gout, or you have had gout before, or you have someone that has gout and you want proper treatment the proper way, or you want to listen to Dr. Uh, Boyega, on what he had to do right there in Australia for him to be free of this pain for a long time. You could just probably private chat me so that we can put you in a group that would help everyone, to listen to him, and then probably take the same path that led to his remission and recovery. Yeah, someone is asking a question. They say, is the gout pain like pain of sickle cell patient? Wow. I that's well, it's quite difficult for me to know what the Hausas will say that if you have not gone through something before, you might not be able to really describe what it is. I wouldn't be able to tell, but I know gouty arthritis or pain from gout is sudden and very, very disturbing. But I also know that the pain in sickle cell patient, but they have two different mechanisms. So I wouldn't expect that they might behave the same way. Of course, we know pain would always be pain. Um, in sickle cell patient, the main reason for the pain is what we call vaso-occlusive crisis, which is when there's a micro blockage of some vessels, to part of, the body, which will cause, some level of ischemia, and that will cause severe pain in their own case. It could be joint, it could be back, it could be anywhere, tummy, anywhere. So, but in the case of gout, the pain is actually coming as a result of deposition of uric acid and, of course, urate crystals in the joint. So the joints are the one affected in gout as against, any part of the body in the case of sickle cell disease. Um, of course, they have two different etiology or cause and the pathogenesis or the pathway by which they happen. So we will not be able to say that they are the same thing at this point. Any further questions, please? We will still leave this, like I said, we'll still leave these for others to watch, and just please don't mind, the maybe some technical tidbits that have not been well fine-tuned. We'll get better as we continue to do this. And again, we also expect that by the time we want to do the next, live streams, discussion on several other health important things, we'll give enough time, for persons to be aware and be ready to join in the program. Yes, we know we have quite a large community, and we expect, every one of us to also probably take part in every of the things we'll be doing. We're doing more of this also to help us, to get enlightened about, whatever we're doing on the Westpration channel. So it's at this point in time, I would like to call it a wrap. It's been a long day. It's been a wonderful time. Thank you for joining us. Thank you for watching. And I want to say thank you and God bless. Be safe and remain blessed and active. Amen. God bless.